So, you know, as with many things in shelters, you guys come from an array of different organizations. And because of this, the protocols are going to differ, and that's fine. It's going to differ based on your mission. So if you're an open admission shelter that has limited space and is euthanizing a high number of cats, you're going to have a totally different protocol for FeLV testing than a shelter that has selected admission and attempts to adopt out every cat. The Asilomar Accords are going to come into play. So if FeLV positive cats are unhealthy, untreatable, it's going to be a different story than if they're treatable, manageable. Resources. By this I mostly mean money. So money when it comes to retesting cats, money when it comes to having the ability to keep a cat in a cage for 2 months while you wait to retest it. And then staff. It would be nice if we all had expert blood drawers of cats in our shelter, but unfortunately some shelters don't have that ability. So sometimes we have to wait to have blood drawn, and that can create a bottleneck as far as moving cats along into communal housing. And then housing. Communal housing, these guys really should be tested before they're in groups. So that's going to play a part too if you guys are using communal housing in your shelter. So why do we test for FeLV? And a lot of you guys probably know this, but FeLV is a contagious disease, and it has some bad consequences. So cats that are infected with FeLV have roughly a 20 times greater chance of getting cancer, and it's usually lymphoma. These guys get blood disorders, and they also have a weakened immune system. So for a cat in a shelter setting with a weak immune system where they're exposed to a lot of different bugs, you can imagine this can be a challenge for them. Many cats will develop these secondary diseases, and usually they develop them within 3 years of diagnosis, and about 80% of these cats will succumb to their disease. So when we talk about shelter medicine, we really have to think about our cat almost as a herd, like we would think of cows, right? So testing for FeLV protects our population. So by testing that one cat, we're really protecting all the other cats that that animal is exposed to. And we're also protecting our adopters, because our adopters want to know if our cat might get a really bad disease within 3 years, right?